Hello and welcome back to another episode of BTV, the podcast version. I'm Marcus Boston. Hopefully you have been enjoying the show so far. We have talked about a lot of issues, and namely in that last segment, we had an opportunity to talk more in depth about the standard of care issues, which is something that you need to be able to understand and explain before you can move forward and successfully litigate or try to settle a medical malpractice claim here in Maryland. And for this next segment, we have a issue which deals with how a delay in diagnosis caused a stroke. So again, we're talking about the medical aspect of things, and if you're listening to this podcast right now, chances are you've got some questions yourself about medical malpractice issues here in Maryland. And if you're wondering, okay, well, how do I get them to answer one of my questions, or I have a question, or I'm having an issue, what do? You can just send us an email at info@bostonlawllc.com. That's info@bostonlawllc.com, and we will be glad to try to help you out with your medical malpractice issue here in Maryland. But back to the delay diagnosis which led to a stroke. This was a very interesting fact pattern and case scenario in that it was an elderly gentleman who was having some problems with dizziness and some serious lightheadedness, and he took it upon himself to go to his general practitioner, his family doctor. And once he got there, the family doctor did not do any type of neurological workup on him. He just, did some basic tests, I think, and pretty much sent him home with some prescriptions and pretty much treated him for an ear infection. Well, the issue is this. When he went home, he continued to have problems, and he reported back to his doctor the next day, but this time he had facial drooping. So in that 24-hour time period, things had really begun to take off for the worse. The patient was then immediately sent to an emergency room where a full neurological exam was done. An MRI was performed, a CAT scan was performed, and what it showed is that the patient had no blood flow in his right vertebrae and some of the other arteries. And at that particular time, it was discovered that he was in bad shape. So the family care doctor really missed out on this particular case, because what the patient was describing when he came in, a neurological would have been the better way to go with that, because if it would have been done, a full neurological workup, if it would have been done on him, it could have caught the stroke. So when he got to the hospital, no type of clot busting intervention was initiated, because the 24-hour period and the significant delay in things had already caused a lot of neural tissue death. So the patient ended up being paralyzed on the left side, and his life is now changed. I mean, he'll never be able to go back to what he used to do. And so, like I said, if you're listening to this, and especially if you're listening to this section, you'll probably have some questions about some issues and delayed diagnosis of a stroke or some type of delayed diagnosis issue that you're dealing with, and you're looking for someone to talk to about it. Like I said earlier, you can pick up the phone and you can give us a call, 301-850-4832. That's 301-850-4832. If you feel that email is the better way to go, send us an email, info@bostonlawllc.com. We answer a lot of questions like this. And even if you are not looking to hire an attorney immediately, you just may want to just get some more information for your situation. We have a lot of people who do it that way. They just would like to talk to somebody about their issues that they're having here in Maryland. Also, if you do think it is a medical malpractice case and you do want some more information, so you can really hunker down and kind of see what you would be looking at going forward if you wanted to try to go forward with a medical malpractice case, we have a complimentary guide that my partner Renee and I wrote, which deals with what you must know before bringing a medical malpractice claim in Maryland. And I know when we get ready to switch over to the next segment, there's a commercial that is going to play after this segment, and it's pretty much dealing with this book that we have written. It's not really a long book. I think it's like maybe 45 or 50 pages, and you don't need a medical degree to understand it or a law degree to understand it. Just kind of gives you some of the basic things that you got to be on the lookout for when you are trying to go forward with a medical malpractice case here in Maryland. So that's pretty much what I want to talk about this issue with the stroke, because it kind of tied into what we talked about last segment, which was the standard of care issue. And for those who might have missed that segment, what it pretty much means is that anytime you go and see a doctor for whatever type of issues you are having, there is a standard that the doctor has to follow when treating you. There's certain things that the doctor has to do to make sure that he's following pretty much what I like to call, and what a lot of lawyers like to call in this area, the safety rules, to make sure that he's doing or she's doing everything that they're supposed to do to help you get better. And if a doctor does deviate from these rules, and that deviation causes you some type of injury or to suffer, some type of mistake or something like that happens because of them, because of the doctor deviating from these safety rules, and it causes you, pain and issues and all of that, then you may have a claim for medical malpractice here in Maryland. Now, the next segment after this, we're going to talk a little bit more. We're going to get a lot more in depth into that, and we're going to spend some time discussing why you have to have another doctor to come on board and say that your first doctor or your first medical professional messed up some type of way. You essentially got to have that second doctor to come in and say that the first doctor or the first professional messed up. So, but that's going to be, we're going to have a guest to talk about that in this next segment. So I'm Marcus Boston, and I'll see you on the other side. You have just listened to a podcast from the trial attorneys at Boston Law Group, LLC. For more information, you can reach us at 301-850-4832. And if you would like us to answer a question in one of our podcasts, send us an email at info@bostonlawllc.com. Thank you, and have a great day.
Is 3 seconds enough time to review your scans and x-rays? Every second counts. Don't get left in the dark.